Accelerate Long Beach Healthcare and Wellness is brought to you by the Long Beach Economic Partnership, with generous support from Union Bank, Memorial Care Long Beach Medical Center, and Miller Children's and Women's Hospital, Long Beach, Dignity Health St. Mary Medical Center, the Long Beach Economic Development Department, the Downtown Long Beach Alliance, and the California State University Long Beach Office of Economic Research.
Welcome to Accelerate Long Beach, the quarterly forum from the Long Beach Economic Partnership. I'm David Summers, publisher of the Long Beach Post and Long Beach Business Journal. I'm going to be your host today, and later on I'll be moderating a live Q&A panel with our economic experts. So, if you have any questions that you'd like me to ask after our economist presentations, go ahead and submit them in the chat. In some of our most recent Accelerate Long Beach forums, we ventured into space with a focus on the booming satellite launch, aerospace, and rocket development industries here in Long Beach. We've sailed into the goods movement, trade, and logistics sector based right here around the Port of Long Beach, one of the largest in the world. And we've served up a look at our hospitality and tourism industry, which in Long Beach alone accounts for nearly 20,000 jobs and $1.8 billion in local economic impact. But today we're doing something a little different and a little special. Instead of looking at entire sectors or industries, we're exploring a specific workforce, jobs in healthcare and wellness, and why new graduates or workers looking to make a move or anyone looking to build their career in healthcare might want to make their home right here in Long Beach. 1 out of every 5 jobs in Long Beach are in healthcare or social assistance, representing more than 36,000 positions. And the growth seems limitless, with more than 1,300 unique job openings posted in April, May, and June of this year alone. Today, we're going to hear from city leaders, economists, and company CEOs from our major hospitals and healthcare providers, which make up the city's fastest and largest growing job sector. And the economic forecast presentations by our experts will be coming up in just a few minutes. But first, a welcome from members of our City Council and insights into what makes the healthcare industry in Long Beach special and what makes Long Beach itself a special place to call home.
Thank you so much for joining us today, and thank you to the healthcare workers who are here with us. We can never thank you enough for the sacrifice and hard work you've done in the past 18 months to saving so many lives as well as helping us manage through this pandemic. I am Councilwoman Suli Saro of Long Beach 6th District, home to Long Beach Medical Memorial Care, St. Mary's Medical Center, College Medical Center, as well as many other behavioral and mental health facilities and services. Our industries are only as strong as our workforce, and that is why you are so important. If you're exploring or expanding opportunities in healthcare, you are in the right place and in the right city, Long Beach. Today, we are going to hear from the Cal State Long Beach Office of Economic Research on the healthcare industry here in Long Beach, as well as leaders that will share with you amazing opportunities in healthcare. It's also why it's so crucial that we continue to build and maintain a strong career pipeline to healthcare in this city. We have a lot of exciting opportunities in health and wellness. It's no longer just a focus on physical bodies and mind. It's also building and strengthening communities through partnership, thereby accelerating the healthcare industry here and elevating our local economy. Long Beach is one of the best places to start your career in the healthcare industry because you are able to find several healthcare services to wellness services to behavioral health services that you can choose to work in. Should you decide that you want to also continue education, we have colleges here locally that you can access while you're working so that you wouldn't have to do so much commuting because everything will be local. There's a little bit for everyone as far as your lifestyle, your choice of entertainment and recreation, and also your career and educational opportunities. The broader Long Beach community is amazing. People come together. It's not so big that you feel disconnected, and so that's what's beautiful about the city. While it's a city, it still has this community environment where you feel that you can still get to know all your neighbors and feel like you can create a community here and feel like you're part of something. Not only is it an environment to do business, but also to live and raise a family as well.
What I love most about Long Beach is the fabric of the community. Everywhere I go, people are so friendly. Everyone wants to learn more about our great history and the amazing assets and tools. Many of you know I have a little one, so I spend a lot of time at the parks, and neighbors are just talking to one another, asking each other questions, finding out the new local hot spot for a restaurant, and everyone just pitches in and wants to support being local and staying local and keeping their money local. One of the reasons I love calling Long Beach home is because it feels like a home. The neighbors all know each other and they really work to support each other. If you have a big dream, there's someone in your network in Long Beach that's here to help. When we talk about healthcare industry, we talk about a city that's vibrant with so many different types of healthcare. We have multiple hospitals, we have senior care facilities, we have dialysis. There's so many different ways that you can be a healthcare professional right here in the city of Long Beach. We also are so philanthropic. A lot of our community members have chosen to endow scholarships at the universities that they graduated from. A fourth grader in Long Beach who in 20 years ago scenario would have never had the opportunity to go to college, now not only is guaranteed a seat at Long Beach City College or Long Beach State if they meet the minimum requirements, they also could go there for free. And that really changes the face of your adult life in not taking on an educational costs. One of the amazing things about education in Long Beach is the collaboration across all of our school systems. It's great to be able to reach out as a young person and know that you can sign a college promise that you have a seat available to you at Long Beach City College or Cal State Long Beach to further your education. This was a program that, when it was dreamed up, really discussed the strength of the Cal State and UC system and how they were being recognized as some of the best public institutions in the world, and how having those institutions here in our community meant that we were investing a lot in them and we were requesting that they invest a lot in our future. And they stepped up and they reached out and they have collaborated to ensure that our students have seats at these institutions, which really, really brings about an opportunity that would not have been available 20, 30 years ago. There's also other programs that have been modeled out of Long Beach City College and Long Beach State, including our first year of tuition being complimentary to our students if they meet some minimum requirements. These are things that, paired with the generosity of alumni who have endowed several hundreds of scholarships, means that when you graduate from a university here in Long Beach, you could be debt-free and take on additional education, whether it's a credential program or a registered nurse program or whatever those are. You would be able to do that and step into that without the burden of debt from an undergraduate or community college degree. Within Long Beach, you can choose a corporation or company and know that they collaborate with a lot of other companies in your industry, which really keeps doors of opportunity open throughout your career. Then, as you embark upon a family, if that is your choice, you have a lot of amazing communities to live in where your youth can thrive. We have parks programs and early education programs and an amazing school system right here. You can really develop your entire career and grow without changing your address.
Thank you, Council Members Sorrow and Mungo. Our first presentation and forecast today is from Dr. Robert Kleinhens. He's the principal economist and founder of the firm Kleinhens Economics. He's also a lecturer on the faculty of the economics department at our very own Cal State Long Beach. A leading voice on the economy at the national, state, and local level, Dr. Kleinhens taps over 30 years of experience to present his outlook for the economy and its leading industries, and to offer his perspectives on leading policy issues. Dr. Kleinhens has held several positions over the course of his career, most recently as economist and executive director of Beacon Economics. He previously served as the chief economist for the Los Angeles County Economic Development Corporation, LAEDC, and deputy chief economist with the California Association of Realtors. He's also held academic positions at USC, UC Riverside, and Cal State Fullerton. Dr. Kleinhens is known for his extensive knowledge of the economy and economic policy. He's a frequent contributor to the media and has appeared on CNBC, Bloomberg, and NPR, and has been quoted in news outlets including the Wall Street Journal, the Los Angeles Times, and of course, the Long Beach Post and Long Beach Business Journal. Welcome, Dr. Kleinhens.
Hi, I'm Robert Kleinhens. I'm an economist with Cal State Long Beach, and I'm here to bring you the outlook for the U.S. economy and for the California economy. We're going to take a look at the California economy in just a minute, but first we're going to take a look at the U.S. economy because it serves as an important backdrop to what's happening here in California and here in Southern California. We'll also take a look at housing before we wrap up and take a look at where we see things going into 2022. So for the U.S. as a whole, we're really shifting gears at this point in time from recovery to expansion. Yes, there are a few signals that are still in recovery mode, but there's some other signals that are in expansion mode. So I'll talk about each of those in order. And so when we take a look at the economy, we look at its vital signs. We look at the labor market. We look at GDP. We look at the rate of inflation. And here what you see on screen is that the unemployment rate for the U.S. has fallen to 5.2%. So it's essentially 1/3 where it was during the worst days of the pandemic last year in the spring. So that's good news. And on top of that, we've been closing the jobs gap that's been created by the job losses that occurred back in the spring of last year. We lost 22.5 million jobs nationally. At this point in time, we're down to just 5 million jobs as our current job gap. And as we move forward through the balance of this year and into the first part of 2022, we would expect that that job gap is going to be eliminated. So we'll be back on track. We'll be in an expansion mode. So we've been saying all along that it would take well into 2022 for us to recover all the jobs that were lost during the pandemic, and we seem to be on target with that particular outlook. Now, it's important to note that at this point in time, we actually have more job openings than we have unemployed persons. And so the opportunities are there for people to get jobs. It is taking longer than usual to fill those positions for any number of reasons. But this is good news. The economy, the businesses are poised to hire. They want to expand, so that's good news. And as you can tell here, the number of unemployed has come down markedly compared to last year. So that's also good news. So the labor market's moving in the right direction. As for GDP, which is the total value of output produced in the economy, it's actually shifted from recovery to expansion. So going back to last year, just before the pandemic began, we were just at the tail end of the record expansion that ended in 2019. Then in the first half of last year, we saw GDP fall fairly sharply, really by an unprecedented amount when you take a look at what happened in just 2 quarters' time. And for all of last year, as you can see over on the right-hand side, we lost GDP to the tune of 3.5%. But really, beginning with the second half of last year, we continued, we turned things around, we started to expand. We virtually recovered all lost GDP near the tail end of the first quarter of last year. And as you can see, as we moved into the second quarter, we actually set a new high for GDP level over on the left-hand side. So that means that the economy has shifted from recovery to expansion mode. And for this year, we think we're going to see the economy grow by about 6%, 5.9 is the current estimate, which actually would be the fastest growth rate we've seen since the 1980s. So this is good news for the national economy. It's good news for California and for Southern California. And even looking out past 2022 to 2023, we think that GDP is going to continue to grow nicely and above trend. Trend's about 2%. Now, what's fueling that is strong growth on the side of the consumer sector. Consumers account for about 2/3 to 70% of economic activity in the U.S. economy. So as the consumer sector goes, so goes the U.S. economy as a whole. And of course, we had a whole succession of relief packages that increased personal income, as you can see here with the black line. But all of that has basically provided a financial backstop to households so that they've been able to continue their spending after pulling back in the first half of last year. And that's been good for the growth pace of the economy. On the business side of things, the other segment of the private sector of the U.S. economy, things have been mixed. Overall, business spending's up, as you can see on the left-hand side. But investment in structures has been down 4 quarters in a row. And that's mainly because, given the great vacancy rates that we've seen in office properties and other types of commercial properties, there's no incentive to build anything new at this point in time. But firms are looking forward. They're seeing that there are opportunities to grow, to expand their workforce, and in order to do so, they're going to have to update and expand their equipment. So we see equipment growth. We also see investment in intellectual property continuing to advance. So these are signs that the business sector is optimistic about the path forward. We still have problems with office vacancies, which of course is the reason why we're not seeing that kind of investment in structures. So this figure right here shows that about 30% of the offices are occupied at the present time. That compares with well over 90% during normal times. So we still have a ways to go before we get back to normal on this score. So we've looked at the consumer sector, 2/3 of the economy. We've looked at the business sector. The third major sector of the economy is trade. And so here what you see is that imports have increased over the last several quarters as our U.S. economy has regained its traction and has moved forward. So that's good. On the other hand, our trading partners are coming back, but not as fast as we are. And so exports have been somewhat sluggish. They are improving, but the improvement is not nearly as great as we've seen on the import side of things. Now, if you live in Long Beach and you've been down to the beach lately, you'll know what that red line implies for the ports of Long Beach and the Port of Los Angeles. The number of containers, as we'll learn later on from Dr. Seiji Steinmetz, is huge. There's a lot of port congestion. We've been hearing about this for about a year now. And so that's not going away anytime soon, because I guess you could say we're fairly starved for import goods. And the supply chain disruptions that you've been reading about in part are showing up on our shores in the form of the kind of congestion that we're seeing with the container ships and other shipping traffic here in the Port of San Pedro. So with those supply chain disruptions, there are concerns about inflation. On the right-hand side, you can see that inflation has been in the neighborhood of 5% for the last few readings. That's not uncommon when we are in a recovery mode. Looking at that red line and drawing all the way back to about a third of the way across the screen, you can see that we had elevated inflation rates as we were beginning to recover from the Great Recession as well. So that's one point to note about this figure. The next thing to note is that when you take out the volatile components of inflation, energy and food, the inflation rate's not nearly as high. And the third point to note is that both core inflation, which I just spoke of, and the overall rate of inflation are both coming down at this point in time. So we think that inflation at the present time, or this elevated level of inflation, is a transitory phenomenon. If you take a look at measures of inflation expectations, they're around 2.5%. So while we're expecting this year's inflation rate to be in the neighborhood of 4.5%, and even next year in the neighborhood of 3.5%, we think that inflation forces are transitory, and expectations of inflation are closer to 2.4%, 2.5%. So we'll see inflation come down. It's not going to come down in a matter of weeks, but more like quarters or months. But it will be coming down. It's not a permanent phenomenon. So that's a good sign for those of us as consumers as well as for businesses. Now, over the last several quarters, we've seen that financial markets and interest rates have been very low, unprecedented lows for the yield on the 10-year Treasury as well as for the 30-year mortgage. And so you can see that the 30-year mortgage continues to be in record low territory, under 3%. The yield on the 10-year Treasury, about 1.3%, also quite low, though not at record lows. And then the benchmark, the federal funds rate is down there at the bottom, holding steady, just above 1%, just above zero. So with very low interest rates, the interest rate environment is one where you're just not getting any return. So investors are looking elsewhere for a return. They're looking to stock markets, and they're looking to the real estate market to invest. And indeed, the stock market's done well during this period of low interest rates. But as interest rates begin to edge up in the next several months, we would expect to see more variability in the performance of the stock market. So just make sure that you've got your seatbelt on and be ready for some additional volatility in the financial markets as we go forward. So the fourth major segment of the U.S. economy is the government sector. And here you're looking at the federal budget deficit, which over the last 2 years, and these are fiscal year numbers, but over the last 2 years, the budget deficit has exceeded $3 trillion. So this has been unprecedented. But you can see here, based on Congressional Budget Office forecasts, that the budget deficit next year is likely to fall to just over $1 trillion, and in subsequent years drop below that $1 trillion threshold. And in percentage terms relative to GDP, by 2022, 2023, will be roughly in line with the historic average that the budget deficit is about 4% of GDP. Now, there are concerns later on in the decade because of the aging population and payouts under our entitlement programs like Social Security and Medicare, that our budget deficit is going to climb again. But we know that the budget deficit will improve over the next few years, and then we've essentially bought ourselves some time to be able to deal with what's happening later on in the decade. So we've looked at the overall U.S. economy. We're seeing a little bit of a mixed picture, but generally speaking, we're looking at forward momentum. GDP is registering expansion. So when we turn to the California economy, the question is, well, to what extent is California participating in this recovery and this expansion? Well, California's been gaining ground. A year ago, or I should say earlier in 2020, the unemployment rate for the state of California was 16%. It's now less than half that at 7.5%. So we've made a lot of progress on the labor front. We've also seen that the job losses, which during the pandemic shutdown numbered about 2.5 million, have been cut quite dramatically, and we've recovered about 62% of the jobs that were lost during that period of time. And those job recovery percentages have been improving and growing rather markedly over the last couple of months, really just since the second half of this year. So that's a good sign for the outlook for the California economy. And in the month of August, the job gains in the California economy were equivalent to about 40% of the job gains for the U.S. as a whole. So that gives you a sense of the extent to which California is recovering, its pace of recovery, and the extent to which it's contributing to the recovery for the U.S. U.S. economy as a whole. So a quick look at the picture for jobs and jobs by industry for the state. As I said, we added over 100,000 jobs in California in the month of August. We've also, in the month of August, in year-over-year terms, added 874,000 jobs. Now, that 0.6% month-to-month increase, that's about the long-run average for our year-over-year increase. The 5.5% increase that we see in year-over-year terms in that final column over on the right-hand side is about 10 times what we typically see in the California economy for its year-over-year gains. So we're making progress, and we're really making progress by leaps and bounds, even though you hear in the news that we're not moving fast enough. And the job gains that we're seeing are happening in the government sector, which saw significant job cuts during the pandemic. We're also seeing big gains in leisure and hospitality, which was the hardest hit sector in terms of job losses. So that's good news. In addition, we've got other key sectors of the economy, including professional services and so on, that are also making big contributions to job growth across the state. The 6,300 job loss in healthcare is likely a temporary phenomenon. We're likely to see that turn around as we move forward from August to September and the rest of the year. So the individual industries of the state are doing better than they have been in recent months, and certainly doing better than they had done last year. We're moving in the right direction. We've recovered somewhere in the neighborhood of 62% of the jobs that were lost during the pandemic. So we're seeing that the California economy is doing exactly what it should be doing at this point in time. When you drill down to the regions of California, you'll see that some of the inland portions of the state have actually done better than the coastal parts of the state. And that's not usually the way things happen when the economy recovers from a downturn. Usually we see the coastal parts of California gain ground first. We see that when you look at the inland parts of California, they tend to be the first to go into a recession and the last to come out. But here you see Stockton-Lodi has recovered 91% of the jobs it lost. The Inland Empire has recovered over 3/4. LA County, which has a heavy dose of industries that were among the hardest hit has recovered 57% of the jobs lost. But that's actually a huge improvement over July, when we were only up by 48%. So, like California, the Southern California regions are moving in the right direction, albeit at somewhat different paces, and we're seeing that recovery is well underway. So let's take a look for a moment at real estate, and I think the operative words here are higher prices and eroding affordability. So when you take a look at the latest home price information for LA and Orange County, you'll see that we're talking about some pretty impressive home prices. LA County's home price, $830,000. Orange County's $1.1 million for the month of August. Now compare that to the single-family home price for the U.S., $360,000. No place in Southern California has a median home price that's anywhere close to the national median. So we've got much higher home prices than elsewhere around the country. We've seen huge increases in home prices in year-over-year terms, as you can tell by that next to last column, up 20% in LA County, 18% in Orange County. Sales are a little bit mixed when we compare August of this year with August of last year, but for the year as a whole, Southern California's sales are up by 23% year to date. So that's fairly impressive for the housing market, especially given the fact that we're still coming out of a pandemic and the economic consequences of the pandemic. But what's really happened over the last few economic cycles is that the housing market performance has been detached from the performance of the overall economy. The housing market has been responding to things like very low interest rates, even at times of high unemployment. We saw that happen most recently in a couple of previous economic cycles as well. So it's low interest rates that are driving the housing market. You can see here the 30-year mortgage is under 3%, as I mentioned before, and home prices are also being driven by very lean supply of homes available for sale. The average inventory, that is to say the average months of homes available for sale, is about 4 through thick and thin over the last 15 years or so for most of these parts of Southern California. And right now we're at 2 months inventory for LA and 1.6 months inventory for Orange County. So very lean inventories bumping up against very strong demand. Keep in mind that from a demographic perspective, millennials, which make up the largest age cohort at the present time, are largely in their prime home buying years. And so we're seeing a lot of demand for housing, whether it's for sale or for rental housing. But it's bumping up against these constraints in the form of very limited supply. So put those things together and you've got a decline in affordability that's really prevailed for quite some time. For Los Angeles County in the second quarter of this year, the Housing Affordability Index was 22, meaning that 22% of households could afford to buy the median priced home, which, as you see here, was $756,000. And the median priced home with a 20% down payment would have been about $3,500 a month in terms of a monthly payment. To afford that monthly payment, you need to have about $139,000. So 22% of households in Los Angeles County have a household income that's equal to or higher than that minimum qualifying income. You can see those affordability numbers have fallen. They're not at rock bottom rates yet. LA County got as low as 9% about 15 years ago. So I imagine we're still going to continue to see home prices advance. We're also going to see that as affordability bites further into the housing market, sales are going to slip. So we've covered a lot of material. Just to recap what we see for the U.S. economy as a whole, we're already in an expansion mode as far as GDP is concerned. So that's good news. Unemployment is in good shape and it's improving. The unemployment rate now is 5.2%. The target is 4.5%. That constitutes full employment for the U.S. economy. So we're likely to hit that mark sometime either later this year or sometime next year. There are a lot of things happening behind the scenes with the labor force that we don't have time to go into. Demographics, the pandemic effects and things like that. But in all likelihood, we're going to hit that full employment mark sometime in the next several months. We've really seen remarkable job gains. You've heard a lot about the fact that we should be adding 1 million jobs per month nationally. You know, that's a lot of hype. It's more reasonable to think that we're going to add jobs in the neighborhood of 300 to maybe 500,000 per month. And at that pace, we're going to get all our U.S. jobs back before the second half of next year, which is very much on track with what we've been talking about all along. So we're headed in the right direction. The pace of growth is really where it's likely to be for the foreseeable future. And maybe we'll occasionally get a 1 million job gain, but it's going to be more the exception than the rule. As you've seen, industry performance varies. The face-to-face industries continue to move more slowly in recovery. Those industries that have been able to capitalize on things like remote work have been able to get back on their feet and get going again more quickly. But all in all, we're seeing that the U.S. economy is moving forward. Its industries are moving forward. Inflation's here. It's not lights out inflation. We're still talking about single-digit inflation rates. And when you take out the volatile food and energy components, we're talking about inflation rates below 5%. And inflation, or the current inflation levels, are transitory. So we expect to see in the months to come that they're going to come back down to what we think are normal inflation levels. Of course, as the economy gets going, the Fed begins to increase interest rates, market interest rates begin to rise, we'll see greater stock market variability that's almost inevitable. California is gaining momentum, and part of that is due to our success with vaccinations, as well as very, very low levels of indication of the presence of the virus. This is really good news for the outlook for the California economy. Several other states were ahead of us months ago, but many of them right now are combating very high levels of infection and so on. But California is in good shape from improving, I should say, its condition is improving from a public health perspective. That can only help our recovery from the pandemic. Key industries are doing well. Logistics, so that's, California's logistics industry kind of calls the Port of Los Angeles and the Port of Long Beach as its home, or its ground zero. Tech is doing well. Healthcare is doing well. We're beginning to see restaurant activity improve. Hotel activity is picking up. So we're looking for much needed gains in the tourism and hospitality segment of the California economy. Retail's on the mend. These are all sectors that are doing better. Even manufacturing, I could rattle off any number of other industries that have seen gains. It's just that the pace of recovery is a little bit different depending on which one you're looking at. Our unemployment rate's been cut in half, and for California, the target unemployment rate's about 5%, maybe 4.5% to 5%. Again, we're likely to hit that maybe in the middle of next year or thereabouts. We accounted for 43% of all the total U.S. job gains in the month of August. I think that speaks to the vitality of the California economy and its prospects going forward. And we think that we'll see California recover all the jobs that it lost during the pandemic shutdown last spring of 2020 by the time we close out the first half of 2022. So all in all, we look at 2022 as the year in which the California and U.S. economies are made whole again. And from that point, we're going to move forward and into expansion. So I want to thank you for your time and hope you have a good day.
Thank you, Dr. Kleinhens, and a reminder to stick around. He'll join us again later in Accelerate Long Beach to take your questions live. Long Beach, like so many cities, counties, communities, and countries, continues reeling from the terrible impacts of the COVID-19 pandemic. Just last week, our city reached a grim milestone as the pandemic has now killed 1,000 of our friends, family members, and neighbors in a city home to just under 500,000 people. Even as our community passed that awful milestone last week, Long Beach at the same time continues to see a rapid recovery and robust community vaccination program, with 76% of eligible residents ages 12 and up having already received at least one dose of a coronavirus vaccine. Central to our response and recovery, and another highlight of the unique strength of our healthcare ecosystem in Long Beach, is that we have our own city health department. We're one of only 2 major cities in the region and just 3 statewide with a local health department, able to rapidly respond, to have access to resources, tailor advocacy, efficacy, and response to the needs of our community. As Long Beach's health officer, Dr. Anissa Davis quickly became one of the trusted leaders of the city's coronavirus response. Dr. Davis has lived in our city since she was 6 years old. She graduated from Poly High School, attended UCLA, then graduated from Stanford Medical School. She first worked for the Long Beach Department of Health and Human Services as a public health physician specializing in biological bioterrorism agents from 2002 to 2005. Then she continued her career in Los Alamitos as a family physician. She then returned to Long Beach in September 2016 as the city's health officer. And now, 5 years later, she finds herself in the spotlight like never before, leading our city's public health response through the ongoing pandemic. Welcome, Dr. Anissa Davis.
Good morning. I'm Anissa Davis. I'm the City Health Officer for the City of Long Beach, and I am going to review where we are with COVID locally right now. Next slide, please.
The clicker's right behind you. I'm sorry, on the table.
All right. Okay, so currently we have, as of the 17th of September, we have 63,190 cases among Long Beach residents of COVID-19 since the pandemic started. Currently, we have 56 Long Beach residents who are hospitalized, and we have 71 individuals who are hospitalized in Long Beach area hospitals, so that includes other hospitals right outside the city of Long Beach. Unfortunately, 1,002 people have died from COVID-19, Long Beach residents, since the pandemic started, and 60,797 people have recovered from COVID-19. So our current case rate, which is the cases per 100,000 population, is 19.5 per 100,000 population. And our current test positivity is 2.2%. And the CDC uses those numbers to calculate our level of community transmission. And where we are right now is considered high community transmission, which is actually the highest category of community transmission. We, however, did hit our peak of the case rate and the test positivity in mid-August, and we've been slowly going down since then. So while we're still in a high community transmission, we have been noticing, if you look at the lower right bump there of that curve, that's where you can see that we are starting to kind of flatten now, very slowly. It's just been a slow kind of decline. So the next couple of slides are just going to kind of highlight where we're at with our cases, hospitalizations, and deaths, and really to highlight the point that this really has shifted to be a pandemic of the unvaccinated. So if you look at the cases here, these are all the cases, and the dark green line is folks who are unvaccinated, cases among people who are unvaccinated, and then the dotted green line are the cases among people who are vaccinated. And then the total is the gray line. And what you can see here is that the case rate is much higher among those who are unvaccinated, really driving this current surge. And then this is a similar curve now highlighting hospitalizations. So again, the dark blue line is hospitalizations among those who are unvaccinated. The dotted blue line is among people who are vaccinated and have been hospitalized, and then the total is the gray line, and then shifting through time is the x-axis. And so you can see that there's this wide discrepancy again from people who are unvaccinated and vaccinated as far as people needing to be hospitalized from COVID. So as of February 2021, when vaccinations were kind of getting started and really taking off, you can see that 88% of hospitalizations were among those who are unvaccinated, and 95% of the total deaths were among people who were unvaccinated. And then this graph really goes through the case rates for different age groups. So just to kind of walk through what all the different ages and colors are. So the light blue line is 0 to 4 years old, cases among 0 to 4 years old. The dark blue line is 5 to 17-year-olds. The gold line is 18 to 49. The gray line is 50 to 64. And then the red line is the case rate among those who are 65 years of age and older. And so what you could see is that the gold line, the 18 to 49-year-olds, have always kind of been pushing and driving the pandemic. So they've had some of the highest case rates kind of throughout all of the surges. But what you can start to see, and then that's followed by the 50 to 64-year-old in gray, were kind of the second highest group of case rate. But what you can start to see as the vaccinations start to get implemented is that because we have so many of our older folks vaccinated, our 65 and older and our 50 to 64, that they've started to kind of go down, and you've seen a widening of the gap with the gold, the 18 to 49. There's now they're much larger than everybody else, and that's because everybody else has gotten more vaccinated, as we'll see. The 18 to 49-year-olds are kind of lagging in the vaccination rates. And then the other thing that you start to notice with this latest surge is with the dark blue line and the light blue lines, which are the younger folks, is that they're starting to get higher, and that's because they're not eligible for vaccination right now. And so they're going to have a higher proportion of the total cases just because vaccination is making it so the other age groups aren't having as many cases. And then just to note this blue blip here, this dark blue blip here, and then over there on the edge, and that is cases among 5 to 17-year-olds that occurred when LBUSD was doing, Long Beach Unified School District was doing their mass vaccination. So that's why we see that little blip, is because they were vaccinating tens of thousands of people at that time. This chart shows some comparisons in cases, hospitalizations, and deaths among different races and ethnicities compared to whites in the city of Long Beach. So starting at the top row, Native Hawaiian and other Pacific Islanders such as Samoans and Tongans, you can see that population has a much higher risk of cases, hospitalizations, and deaths than compared to the white population. So this population has 4 times the number of cases, the number of rate, the rate in this population is 4 times as high as the rate in the white population. And then again, in hospitalizations, the rate is 9 times as high, and then deaths is 7 times as high. And then you can see for the Hispanic or Latino population, the rates are also higher than the white population, as well as in the Black or African American and Asian population. So to turn a little bit to the Delta variant, which is really kind of, driving all of the surges. It's the predominant variant in the US and California and Long Beach right now, accounting for about 99% of the viruses that are sequenced. And Delta has really changed the way that the virus and the pandemic behave because it's just so much more contagious than the wild type variant. So the variant that we first knew about back in the beginning of the pandemic, one person could be expected or estimated to infect about 2 other people. And then when we got the Alpha variant, which was a little bit later, and that was the variant that originated in the United Kingdom, and that was more infectious than the wild type variant. And that person who was infected with the Alpha variant of Delta could be, the Alpha variant of COVID-19, sorry, could be expected to infect up to 4 to 5 more people instead of 2. So that was a game changer. And then with the Delta variant now, one person who's infected with the Delta variant of COVID-19 could be estimated to infect up to 5 to 8 more people. So when that happens, it really just changes the way that you can respond. It changes the way that that pandemic looks, because each person is now infecting, 5 more people, 5 more people, 5 more people. And so that is really driving the surges during this time. So just to review again, the Delta variant, it spreads more than twice as easily as previous variants. New data shows that people infected with the Delta variant can have a lot of that virus in their nose and their mouth, which they think might be one of the reasons why it's so more contagious. Fully vaccinated people, it does look like they can transmit or pass the virus on to others. So if you're fully vaccinated and you become infected, data right now looks like you can pass it to other people. High vaccination coverage will reduce the spread of this virus and help prevent new variants from emerging. So the fact that it's so contagious just means it's even more important that people become vaccinated. And as overall cases and proportions of the population become vaccinated, you will see breakthrough cases. Because of that. So I think the thing that's important to note is that the vaccines continue to be effective, even with the Delta variant. There's a lot of conversation and debate right now and discussion around booster doses. Even though the vaccines are working very well right now, especially against hospitalizations and deaths, there is some concern that maybe immunity may wane from the vaccination, or the effectiveness may wane with time. And so there probably will be more information coming out around recommendations for boosters in the very near future. But the bottom line is that the vaccines are working very well right now, even against Delta. So it's very important that anybody who can be vaccinated get vaccinated. So just to briefly go over some vaccination data. So 300,738 Long Beach residents have at least received 1 dose of vaccine, and 78% of adults have received at least 1 dose of vaccine as of now. So that's great. The second box right here just has the different vaccination percentages for different age groups. And so you can see that the 18 to 34-year-old has the lowest rate of vaccinations out of all the ages. And the 65 plus has an excellent vaccination rate, which is great because that's where we were seeing most of the severe outcomes. And then the 2 charts over here on the left are just going over vaccination rates among different races and ethnicities. I'll just direct you to the bottom chart, which just goes over what percentage of that particular population is vaccinated. So go to the last column. 66% of all Asians living in Long Beach right now are fully vaccinated. 46% of all Black people living in Long Beach right now are vaccinated. 53% of Hispanic or Latino. 37% of multiracial individuals. 73% of Pacific Islanders, and 66% of Caucasians or white population is fully vaccinated as of right now. And I'm just going to end with reviewing some of the state and local orders that are that have been put into place as of right now. So all individuals are required to wear a face covering while in indoor public settings. Healthcare workers are required to be vaccinated. Medical and religious exemptions are allowed. Visitors to acute care hospitals or skilled nursing facilities must provide proof of vaccination or a negative test. Public and private school staff must verify vaccination status and undergo weekly testing if unvaccinated. Participants of indoor events of greater than 1,000 individuals must provide proof of vaccination or a negative test prior to entrance. And then participants of outdoor ticketed or defined events of greater than 10,000 people will also need to provide proof of vaccination or a negative test. Patrons and employees of bars, wineries, lounges, breweries will be required to provide proof of vaccination prior to entry. And restaurants are strongly recommended to reserve indoor seating for those who are fully vaccinated. Several ordinances have gone down around our city, plus the county, state, and federal employees requiring to provide proof of vaccination or to test regularly. Athletes over 12 participating in certain high-risk sports are required to undergo regular screening testing. And more will be coming down the way with the implementation of Biden's recent announcement of his COVID-19 action plan. So that ends my overview of the state of COVID-19 in the city of Long Beach. Thank you.
Thank you, Dr. Davis. Our next economic update is ahead in just a few minutes, but first you'll hear from several of our hospital, healthcare, and academic leaders about the benefits of a career right here in our community. With 5 area hospitals, including 2 major medical centers, Long Beach has a rich and cutting-edge ecosystem of career pathways that are community-centered, all in an oceanside city. Now it's time to learn how healthcare workers can enjoy professional opportunities and a quality of life balance in Long Beach that are hard to find anywhere else.
One thing that's unique about our 2 hospitals, Miller Children's and Women's Hospital and Long Beach Medical Center, is that we have both a children's and an adult hospital. And so we're able to take care of our community members for their entire life. And there's very little that we don't do. There are academic medical centers may do a few procedures, but we're really able to take care of everyone's needs in our community. And we're just so proud of the partnership that we have with the community and with the city as well. The collaboration with the community was so important in seeing us through this pandemic. The outpouring of support, whether it was emails, food donations, it's just been incredible. And our staff is so appreciative because it made them realize how important the services that we provide to this community are. Having our own Department of Public Health has been absolutely critical because we're able to be more nimble and react in ways that other communities aren't. Long Beach, through the collaboration between the healthcare providers and the city and the Department of Public Health, was actually a role model nationally for disseminating the vaccine. We had the first vaccinations in Long Beach given on our campus. The mayor attended, and it was really an inspirational moment in a turning, if you will, in the battle against the pandemic. Memorial Care is a family. And we have many employees who spend the entirety of their careers here. We put the patient first, we take care of our employees, and we do everything that we can to support them in what is hopefully a very long career with us. We really do everything that we can to stay at the forefront of technology because we know how important it is for our physicians and for our patients. People really can make a career here and live in Long Beach and embrace the Long Beach community. We're proud to take care of them, and they're proud to have us be the hospital that serves them in this community.
For 98 years, we have been serving this community. It's been our mission to care for individuals regardless of who they are. We've been that beacon of light for them. So many of our employees live in this community. They come to work every day with such conviction for the community. Also, the fact that we are a level 2 trauma center. It's complete wraparound services. We provide social services. We have our physicians who are here. We provide dental services. We have such a wide variety of opportunities. We have physicians, we have executives, we have nurses, we have entry-level positions. And so having healthcare jobs is great because we attract so many people, but Long Beach sells itself. It's a great community. We have arts, we have entertainment, we have great schools. It's really not been a hard sell. With the booming downtown area, whom we've recruited younger people to the community, they often want to live in the downtown Long Beach community so they can be in the middle of all the activities that are occurring. And then we have neighborhoods for families. We have so many employees who have been here for a long time. It's our employees that tell that story. This is a hospital where people are going to be invested in you. They care about your growth. We have employees here at St. Mary Medical Center who started their career as nurses that are now working in the C-suite. So that's the great thing about hospitals, is that there are so many opportunities. There are employees that maybe started in entry-level positions that have been here for a long time, and they've been able to advance, and now they're in positions in other departments. They're working in executive opportunities. And so there are lots of opportunities in hospitals if individuals are willing to grow. We're here to take care of everyone. We want to be that beacon of hope for our community and for all of our patients. And when people walk through the doors of our hospital, we want them to know that they're going to be treated with respect and dignity.
Long Beach State University is a premier student-centered university. And we in the College of Health and Human Services have about 8,500 students studying across different degree programs that will eventually enter the workforce in allied health and in clinical care fields. The College of Health and Human Services is about people and helping them to live happier, healthier, and safer lives. All of the degree programs that we have in the college, our students will eventually enter into the workforce that are in service to people. Many of them will enter into the clinical healthcare fields. Others will be in allied health and wellness fields, while others yet will be in local government, community affairs, and nonprofit organizations, as well as business and industry. Cal State Long Beach ranks in so many different organizations as a top institution that does extraordinarily well with social mobility. We're one of the top universities in the country. We are certainly geared toward creating a very diverse student opportunities to really try and build a workforce that reflects the communities that we actually serve. And in the College of Health and Human Services, over 42% of our students identify as Latinx. And so this is really an exciting part of what we do, I think, in the university, but especially in the College of Health and Human Services. Our School of Nursing is ranked #2 in the nation and #1 in the state of California by RN Careers. I think that one of the reasons why is that our students perform well. This past year, we boast a 99.4% pass rate, which is near perfect for the NCLEX exam, and that's really unheard of. So it's demonstrating once again that not only are we an incredibly good buy for students who are thinking about pursuing a degree program, but we're also one of the top programs in the country.
This school was at the top of my list for several reasons. First and foremost, it has a small class size, meaning that I was going to have a lot more one-on-one time with professionals in the field. The second reason is that it is affordable. As a first-generation Latina student, it's looking for a school is very difficult at an affordable price, and the school had that, while at the same time it still had the academic level superiority that I wanted.
So I applied to the California State University Physical Therapy program because of the reputation it had in the physical therapy community, as well as the board pass rate above 99%. And then I stayed and selected the school because in our second year we have a neuro pro bono clinic, so we actually get to work with patients that otherwise would not be able to receive treatment in a one-on-one capacity at the university free of charge. So these are patients that either their insurance ran out or they just couldn't receive treatment for whatever reason, and we get to see them and they become part of our family. And we see them for almost a full year, and the changes that we see with those patients is unreal, and there's nothing that we get back other than the learning experience. And that to me brought a sense of community to the school, and that's one of the reasons why I wanted to come here, as well as the care the faculty takes to each one of their students. We're a really small program, 36 students, so each one of us gets to know the faculty very well at a one-on-one level, and they care about each one of us' success.
You're watching Accelerate Long Beach, brought to you by our generous sponsors and the Long Beach Economic Partnership. Our next presentation and forecast is from Dr. Seiji Steinmetz, Professor and Chair of the Economics Department and Director of the Office of Economic Research at California State University, Long Beach. He first joined the university faculty in 2005 and has been chair since 2016. Prior to his academic appointment, Dr. Steinmetz was a senior economic consultant at Bates White LLC and BW Analytics. That's where he specialized in litigation consulting and life science analytics. His research expertise is in applied econometrics with emphases in transportation, urban, and environmental economics, all of which I can barely pronounce, let alone understand. His research is published in leading economics and interdisciplinary journals, and he's a frequent media contributor in many different publications at the national and local level, including also the Long Beach Post and Long Beach Business Journal. Welcome, Dr. Steinmetz.
Well, thank you, David, for that generous introduction. Let's take a look at what's going on with the Long Beach economy and that of the surrounding region. Again, I'm Seiji Steinmetz with Cal State Long Beach, and thank you for joining us today at Accelerate Long Beach. What I always like to do is start with Los Angeles County. The Long Beach economy follows Los Angeles County's economy pretty closely, so it's a good idea to frame what's going on in Long Beach in terms of what's happening in the surrounding region. And first, let's look at the demand side of the market. So let's look at what's happening with consumer spending in the county. What I like to do is show throughout these slides is a comparison of pre-pandemic times to current, right? To get a sense of where we are compared to before this whole pandemic started. So in this chart, for example, I'm showing you what is the percentage change in consumer spending compared to, say, January 2020, to give us a sense of the before pandemic and after pandemic, or where we are now, trajectory of our recovery. And I'm going to do that as a common theme throughout many of these slides. So consumer spending is strong. Right? Of course, we saw a big dip in consumer spending as we started social distancing and quarantine in the early days of the pandemic. And consumer spending started slowly recovering, but it was right around April of this year, one full year after the worst of the pandemic last year, that we started to see consumer spending go above pre-pandemic levels. And then ever since then, really this year, there's been a sharp increase in consumer spending. So demand in the county is strong, which foreshadows that, as Dr. Kleinhead says, we are sort of coming out of a recovery stage and heading more into an expansion stage. As of right now, consumer spending is up about 13.4% compared to January 2020. Spending changes are mixed, though, depending on which industry you're looking at. So if we look at our leisure and hospitality industries, for example, that is accommodation and food services. So these are our hotels, our full-service restaurants, limited service restaurants, caterers, right, all of our food service industries. That's going to be represented in the green line here. We see consumer spending, it of course took a dip, as did arts, entertainment, and recreation. So these are our performing artists and recreation venues. We saw massive declines, right? Very sharp declines. These two industries, our leisure and hospitality industries, got hit harder than most of the other industries, and we saw were slow to recover. But around this summer is when we saw spending on accommodation and food services actually rise above their pre-pandemic levels. So while the recovery has been a little bit slower in spending in accommodation and food services, it's up now about 2.5%. Arts, entertainment, and recreation spending is lagging a little bit behind that, but still the trajectory is upward. Right now, our spending on arts, entertainment, and recreation is down about 5% compared to pre-pandemic levels. If we look at retail and transportation spending, retail spending is up very strong. Compared to before the pandemic, retail spending is 22% higher than back in January 2020. And in fact, you see, except for when we had a drop in retail spending associated with the great uncertainty of the preliminary part of the pandemic, when everything was essentially closing down, we saw retail spending recovered pretty fast and has been rising ever since. And that's as we started substituting away from things we weren't allowed to do face-to-face and started substituting, we weren't buying experiences because we couldn't get out and experience them. Instead, we were buying stuff. And right now, our buying of stuff is increasing. And in fact, if you look out into the San Pedro Bay ports, if you look at what's going on at the Port of Long Beach and Port of Los Angeles, and you see all those container ships lined up out there, it gives you a sense of the impact of the spending is having. So we are definitely in, there's a lot of purchasing power out right now, and our local consumers are definitely using it. Transportation, on the other hand, this red line, compared to before the pandemic, of course there was a big drop. in transportation spending. So this includes air travel, but also spending on things like gasoline, spending on using our vehicles. And that's been pretty low and stayed pretty low. There's been a slight increase this year, but right now we see transportation spending flattening out at around 14% below pre-pandemic levels. And what we might consider here is that our spending on transportation has structurally shifted downward. Right, as we have learned new ways to work and we've learned alternatives to commuting and learned how to work remotely, it's possible that we're seeing what might be a permanent shift downward in the amount we spend as an economy on transportation, especially with regard to what we spend to commute to work. Healthcare spending is up very strongly. Healthcare spending is up almost 34% compared to before the pandemic. And actually, healthcare spending, except for, again, during the worst part of the shutdowns, healthcare spending never really dropped. I bet there are several College of Health and Human Services master's theses that can be written to try and explain why we've seen such a sharp increase in healthcare spending. I'll look forward to our young Cal State Long Beach scholars producing that kind of work. But one might surmise, for example, that it's not just the impact of COVID on our healthcare system, it's also all of these stresses and conditions that are related to having to live through this pandemic. I suspect, I know, for example, that people are grinding their teeth a lot more, and there are a lot more people in dentist offices getting crowns put in from all the cracked teeth, from all the stress that's really pandemic-induced. Again, I'm not a health expert. We can only speculate, but I look forward to seeing explanations for why we've seen such a sharp increase in healthcare spending since before the pandemic. Now, how does this translate to employment in the county? Well, employment is still down a bit, but definitely recovering. Again, let's go back to right before the pandemic. Once we started having a bunch of closures and a lot of quarantining and sheltering in place, as Dr. Robert Kleinhans likes to say, in 1.5 months, we lost all the jobs that we gained since 1996 in just that 1.5 month period. And we've been steadily climbing back towards our pre-pandemic levels of employment. Right now, employment is of course climbing in the county, but still 7% below January 2020 levels. So there are about 330,000 jobs left to recover in the LA County economy. Now, in terms of unemployment rate of our LA County residents, the unemployment rate right now is hovering at about 10%. Currently in August, it's at 9.7%. That's down from 10.2 and 10.3% earlier in the summer. So again, during normal times, if there were not any pandemic and I said to you, hey, unemployment is around 10%, that would be pretty bad news. But in light of coming out of an era where we had upwards of 17, 18% unemployment in the county, 9.7% is a pretty good place to be. And as Dr. Kleinhans suggested, we would expect to see this unemployment rate continue to fall as our demand is building and our economy is really going into expansion mode. Now, who's leading the job growth right now? What I have here is just showing you percentage increases in employment across these different industries just since June. So just since summer, who's leading the charge in terms of employment recovery? And we see that the big leaders right now, for example, are art, entertainment, and recreation, information, accommodation, and food services, personal care, and other services. Okay, these are all industries that were hit hardest during the shutdown. These are all industries that rely a great deal on face-to-face interaction. So, and information, for example, that relies on face-to-face interaction because that includes motion picture and sound recording. Recall that many of the studios had to shut down during the worst of the pandemic. So these hardest hit sectors are the ones that are leading the charge back. And across the board still, there have been employment gains really across the board, except for in some of these categories like retail, trade, and manufacturing, but these are just fluctuations, right? They're very small percentage losses. These are small equilibrations over the summer. The one exception to that is state government education. Compared to, in the last few months over summer, we've seen a pretty substantial drop in employment in state university employees or state-funded institutions in education. There aren't massive layoffs at state government institutions. Don't worry about that. What's happening most likely is that there's cautious spending, right? We're in uncertain times. State budgets have to be planned years in advance. So there have been hiring freezes or cautious hiring. So it's really, we're not replacing separations and retirements as quickly as we would in more stable economic times. So overall then, and this is the kind of chart I've been showing to you, our Accelerate Long Beach participants, I've been showing you for the last year and a half, where are we compared to before the employment? What is our employment level? How has employment changed compared to before the pandemic? And we see overall, everything's still in red. Okay, so things are getting better, but compared to before the pandemic, except for transportation and warehousing, which is seeing gains now. Actually, employment is up. If you look out into the harbor, it's no surprise why there's increases in transportation and warehousing employment. But across the board, we still see we still have a little bit ways to go. We still have jobs to recover in the county. The state government education figure is, of course, large for the reasons we discussed before. But again, we have these hardest hit industries that are still lagging behind in the recovery. So in short, our hardest hit industries, they're the ones who are leading the charge back as things reopen, but they're also still the ones that are struggling the most to recover. All right, I can't emphasize this enough. I do this every time and it bears repeating. Let's consider though, when we look at these overall figures, these overall levels of employment gains and recovery, let's not forget though that there are differences in the income distribution of these recovery effects. So for example, using the same metric that I've been showing, if we compare changes now in employment compared to before the pandemic compared to January 2020, if we look at jobs that earn more than $37,000 a year, so jobs roughly more than the median income in LA County, we see that of course there was a drop, things have climbed back a little bit, and in that upper end of that upper half of the income distribution, jobs are down about 3.4%. So not quite fully recovered, but almost there. In the meanwhile, if for jobs earning less than $37,000 a year, employment is still down 24% compared to before the pandemic. And it's not just that it's down so much for that lower income group. I put a dotted line here, that's 24%, that dotted line right there. And look at how this trajectory is dancing around that dotted line. What I'm saying is, not only has the lower income earner group, right, that category of jobs, not recovered nearly as well as the rest of the income distribution, it really hasn't improved much since about May of last year. Since as we just started climbing out of the worst of the pandemic-induced recession, employment among low-income workers has not changed much at all. So what are some takeaways we see from the county data? Look, consumer spending has finally surpassed pre-pandemic levels. We're recovering and expanding. Retail spending is especially strong. Spending on accommodation and food service, that's catching up, so people are starting to go now to restaurants, bars, full-service restaurants more frequently than we could before. Spending on arts, entertainment, and recreation is recovering more slowly, but still gaining. We may be seeing a structural change in how we spend on transportation as we learn to work in different ways and remotely. And healthcare spending never really declined, except for briefly. Healthcare spending is strong and getting even stronger. Overall, the employment recovery is lagging the spending recovery, and that's normal. That's what we typically see in any kind of a recession. The sectors that were hit hardest by the pandemic are indeed leading the recovery, but overall employment is still below pre-pandemic levels, except in transportation and warehousing. And finally, again, the employment recovery is still lopsided. In past economic meetings like this, I've talked about a K-shaped recovery. This is what I mean, is for some income groups are faring much better in this employment recovery than other income groups are, with those who are in the lower half of the job earning distribution are still well below, the employment level is still well below their pre-pandemic levels. Okay, so how does that translate to what's going on in Long Beach specifically? So Long Beach employment is still down, but getting better. This blue line, when we talk about unemployment, one thing we also need to talk about is the labor force. Like not just how many people are looking for a job and have a job, but also how many people are looking for a job in the first place. This blue line shows the trajectory since January of 2020, the trajectory of the labor force. And we see that the labor force in Long Beach, that is the amount of our residents of Long Beach who are participating in the labor force, that's about 3% below its pre-pandemic level. So that is nearly recovered. All right, so the labor force is back. Now it's a matter of getting everybody in the labor force back into work. Employment right now represented by this darker line, is about 8.4% below its pre-pandemic level. So again, things are getting better, but we still have some ways to go. We still have about 8.4% of the jobs in Long Beach, or really the employment among Long Beach residents, that we need to get back. In terms of unemployment rate, Long Beach is currently at about a 10.2% unemployment rate. That translates to about 24,000 Long Beach working residents who are currently looking for work. Now, I always like to show, we always have limited data on what's going on in the Long Beach economy. So I always try and show these leading indicators of what might be happening in the near future. And one of them is Long Beach initial unemployment insurance claims. So these are new claims filed per week for people who are, for the first time, filing for unemployment benefits. And again, we're all familiar with this trajectory now. Right now, new unemployment claims are about 146% of their pre-pandemic, or 146% higher than their pre-pandemic levels. So a little more than twice their pre-pandemic levels. So there's still a lot of claims being filed compared to normal, but compared to, say, April of 2020, when claims rates were 17 or 18 times normal, right, we're definitely seeing fewer claims being filed. Now, where do our Long Beach residents work, and at what rate are they filing claims? I said that awkwardly, sorry. But really, let's look at insurance claims by industry among our Long Beach residents. And we see that the leaders in terms of filing claims are, for example, personal care and other services, accommodation and food services, private educational services, right, as we were forced to do remote learning, our children were forced to go into remote learning. That had a especially strong impact on private education and private educational support. Arts, entertainment, and recreation. So again, these kind of usual suspects are still among those hiring the file, those are where the claims rates are the highest. So it's showing you that also at the Long Beach level, that it's the hardest hit sectors that are still struggling to recover. They're leading the charge in terms of employment recovery, but overall they're still struggling a little bit more than in other industries. Across the board, we see green means across the board means that unemployment claims rates are still higher in every industry, but just to different levels. Now it's important, these data, right, the next time I show you these data, at the fourth quarter Accelerate Long Beach event, these data are going to change entirely because some unemployment benefits, certain federal unemployment benefits programs are going to expire, actually have expired already in September. And that's the Pandemic Unemployment Assistance and the Pandemic Additional Compensation Programs. Pandemic Unemployment Assistance, it provides unemployment benefits to those who traditionally would not qualify, that is self-employed and independent contractors. And then there's the additional compensation, which provides that $300 weekly supplement to regular unemployment benefits. Those are expiring, or those have expired very recently. So the claims landscape is going to change a great deal the next time I show you this. Now, another leading indicator is looking at job postings by industry. Right? So what we can do is look at who's hiring, and here I'm looking just this year, from January through present. Where are people hiring? What kind of industries are people hiring in the most? And this may surprise some of you, and maybe some of you not. The biggest category for job postings right now is in administrative and support and waste management services. So think about all the people who maintain buildings, who do janitorial services, groundskeeping, people who provide security services to our buildings and facilities. As our facilities and buildings begin to reopen and start meeting their capacity, we're starting to see more and more of these facility support people being hired and in big demand. And of course, professional and scientific, so as our law and accounting and management consulting practices start going back into full swing, we're starting to see more hiring there. Healthcare, we always see hiring because it's a big part of the Long Beach economy that we'll talk about. But across the board, hiring is very strong in every industry in Long Beach. So again, we're still recovering, but there's a lot of evidence that the jobs are there, and now it's a matter of matching people to professions. Now, one thing we need to keep in mind is with this recovery comes certain side effects that we have to keep an eye on. One of them is that the rental rates, the prices that Long Beach renters pay for rental housing, on average are increasing considerably compared to pre-pandemic levels. Here we see, going back to January 2019, here we see the trajectory of Los Angeles and Orange County average rents. In the blue, we see Long Beach's average rent during that same period. Keep in mind, 60% of Long Beach resident households, like Long Beach households, are renters. Right? Long Beach, since before the pandemic, the rental pricing in Long Beach has increased nearly 10%. By comparison, in the surrounding metropolitan area, the LA and Orange County, prices have gone up about 7.4%. So we're outpacing the rest of the economy right now, the rest of the regional economy in terms of rental prices. All right, and then another side effect, which we've talked about a little bit here before, and Dr. Kleinhans talked about, is an overwhelming demand for cargo, especially imported cargo. As our consumer spending is surging right now, that's creating essentially shortages in our supply chain. What we're witnessing is unprecedented cargo volumes at the Port of Long Beach, where since before the pandemic, the loaded inbound container volumes right now are 31% higher than they were. Meanwhile, loaded outbound containers are relatively flat. And we could talk about why when we sit down with with David Summers and Dr. Kleinhans. So some takeaways. We still have double-digit unemployment in Long Beach. There's still about 24,000 Long Beach residents out of work, but our labor force is back. Initial unemployment insurance claims rates are steadily declining, but they're still higher than pre-pandemic levels. And the claims rates are the biggest in the industries that were hit hardest by the pandemic-induced recession. Also, because some benefits programs are expiring, we need to keep an eye on things like the expiration of the Pandemic Unemployment Assistance Program. We need to keep an eye on Long Beach sectors that have a large share of the self-employed. So for example, our nail salons, hair salons, dry cleaning services, our personal care and other services, more than a quarter of that industry is self-employed, and the benefits that they were eligible for have expired this month. Similarly, in arts, entertainment, and recreation, where a lot of our performing artists are gig workers, their pandemic unemployment assistance benefits are expiring this month. That is, the supplemental ones, I should say. All right, rent in Long Beach is going up and outpacing what's going on in the surrounding region. Long Beach households are mostly renters, and this is being driven by both the recovery fueling the demand for rental housing and also a hot real estate market that's limiting the supply. Dr. Kleinhans talked about that too. And then finally, there's record cargo volumes at the Port of Long Beach. There's just rapid growth in consumer spending is fueling the demand for imports. And that's reflected in our inbound loaded container volumes at the port. Exports, on the other hand, are relatively flat, as reflected by relatively flat volumes of outbound containers. Okay, so we're here to talk also about healthcare in Long Beach. So let's take a moment to briefly summarize the healthcare industry in Long Beach. And we'll start off by saying that healthcare is Long Beach's largest employer. In fact, 16% of all employment in Long Beach is in the healthcare industry. And 17% of all the payroll is in the healthcare industry. And what I'm showing you here is, in the blue line, for example, this is the percentage of all jobs represented by healthcare in Long Beach. And we see we're increasing over time, not much, but there's been a general increase in the share of employment and the share of payroll in Long Beach. That is, the share of total jobs that belong to healthcare, showing that not only is healthcare the largest part of our economy, its importance to the Long Beach economy is also increasing over time. What that translates then to is there's about 25,000 people employed in healthcare alone in Long Beach. And that's grown over the last decade. Employment in healthcare has grown by 11.6%. By comparison, total employment across all industries in Long Beach has grown by about 1%. All right, we could break down we could describe healthcare in terms of three major subsectors: hospitals, nursing and residential care facilities, and then also what are called ambulatory healthcare services. So these are our doctor's offices, dentist's offices, optometrists. There also are outpatient care centers, there are diagnostic labs, our medical labs. And if we look at where are the healthcare jobs across these sectors, the majority are in hospitals, right? So 45%, nearly half of our healthcare jobs in Long Beach are in just these 10 hospitals in Long Beach, showing that these hospitals in Long Beach are really big economic engines in our Long Beach economy. And then about a third are in doctors, dentists' offices, labs, and so forth, these ambulatory care services. And then about 19% are in in nursing and residential care facilities. We could also look at what's the employment growth been over the last, say, decade. In each of these categories, we see the leader in terms of growth. We see that nursing and residential care facilities employment has grown by about 24% over the last decade. So among the health industries over the last decade, nursing and residential care facilities is where the most of the growth has occurred in Long Beach. All right, and then we could look at job postings also. If we look at just healthcare industry job postings this year, let me just give you the punchline. 89% of all healthcare job postings in Long Beach have been for registered nurses, LPNs, LVNs, and nursing assistants. So it appears there's a nursing shortage in Long Beach. So what are some takeaways about the healthcare economy in Long Beach? Again, healthcare is Long Beach's strongest and largest employer. In fact, 1 out of every 6 jobs in Long Beach is in the healthcare industry. And almost half of all healthcare employment is in our hospitals. Healthcare employment has grown by about 12% over the last decade, and that's been led actually by employment growth among nursing and residential care facilities. And finally, there appears to be a pretty severe nursing shortage in Long Beach, with 89% of all job postings this year in that industry asking for nurses or nursing assistants. Fortunately, Cal State Long Beach has one of the strongest producers in the region, along with Long Beach City College. Those are some of the strongest producers of nurses in the region, so we're doing our best to help out. And with that, thank you very much for joining us. Go Long Beach and go Beach.
Thank you, Dr. Steinmetz. Well, it's just about time to take your questions live. If there's something you'd like to ask of our economic experts, add them in the chat right now. We'll be right here in our studio in just a moment and be back with you right after this message from Molina Healthcare.
If we've learned anything from the past year, we've realized the importance of community. We work alongside healthcare providers, community-based organizations, and government officials across California who are our partners to help families stay healthy. We're in this together, and we have been from the start. Molina Healthcare was founded in Long Beach more than 40 years ago to serve patients who had been turned away by other doctors who didn't accept Medi-Cal. Molina formed a healthcare network to serve anyone, regardless of their ability to pay. As one of the largest employers in Long Beach, with almost 1,000 employees and their families here, and more than 2,500 across Los Angeles County, Molina Healthcare has served this community in countless ways for decades. Along the way, Molina has stayed true to its roots as a purpose-driven company committed to improving members' health and making a difference in the communities we serve. Most recently, the Molina Cares Accord was established to empower nonprofit advocacy at the local level, helping communities directly through funding programs that support underserved communities. And as the COVID-19 pandemic has strained the entire healthcare system, Molina has stepped up to provide resources to communities across the Los Angeles region, donating supplies, supporting vaccination clinics, promoting volunteer opportunities, donating financial resources. Other supported initiatives, such as Long Beach Rescue Mission, Long Beach Community Champions, and Meals on Wheels Long Beach, showcase Molina's commitment to expanded wellness initiatives and outreach. By working together as a community, we can support our shared mission of health and wellness for all. Thank you for your partnership in our efforts.
Welcome back to Accelerate Long Beach. I'm David Summers, publisher of the Long Beach Post and the Long Beach Business Journal. We're back with our economic experts right now. Robert, Seiji, thank you for joining us. The last time you were here, we were talking about the space industry. It was a little bit different setup last time. We had snacks for you last time. I'm sorry, a little more streamlined this time. But we want to talk about the economy. We want to talk about commerce, healthcare. Robert, I'm going to start with you. You were a little emotional there, a little fairly upbeat about the state of the direction of the economy. But hasn't the Delta variant surge had an impact on the economy and its overall recovery?
Sure. I think that when you take a look at the numbers for the most recent report, for example, here in LA, some of those face-to-face industries that we've talked about have been in recovery. The pace of job growth in the state of California and LA has slowed So I'm talking about leisure and hospitality. Nationally, there were no job gains in the month of August in leisure and hospitality. So certain sectors of the economy are seeing slower growth at this time because of the Delta variant and its impact on the economy, especially certain sectors. But the main message, I think, is that the overall direction of the economy is positive, that it's going to slow but not halt the recovery of the economy.
So, Seiji, to that end, at our last event, you talked about the economic recovery as being K-shaped. Can you remind us, remind everyone out there what K-shaped recovery means, and if we're still in that, or have we moved down the alphabet at this point?
Yeah, so in the past, what I referred to, the K-shaped part of the recovery is really a K-shaped recovery in employment and with regard to income group. So in short, our lowest wage earners have seen flat or possibly, so suppose this is a employment trajectory, right? If our lower wage earners are kind of a flat or possibly down-shaped trajectory of employment, while our upper wage earners are kind of shooting upwards. So that's where the K comes from, is that there's a disparate impact in terms of the wage distribution. Our lower income workers are recovering much more slowly than our higher income workers.
Robert, we had a $3 trillion federal budget deficit last year. And heading into this fiscal year, it's also going to be $3 trillion in the red. Right now, members of Congress are debating whether to raise the federal debt limit. There's been some developments on that just in the last 24 hours. In your opinion, how long can the federal deficit spending in this increase in the national debt go on before we have to do something once and for all?
Well, as I pointed out, number one, the deficit's going to fall as we move into the next couple of years. And as a percentage of GDP, it's going to retreat to an average level of about 4% of GDP. So that's good. Keep in mind that we had $3 trillion deficits over the last couple of years because we had to backfill lost spending on the part of the consumer and business sector with the whole array of stimulus bills that the Congress passed. So it was throwing, use that word loosely, using its power to print money to keep the economy going in the direction and prevent it from falling off a cliff. That said, we do have this federal debt limit that has been in place for 100 years or so, and every so often we bump up against the debt limit and we have to increase it. And so that's where we are right now. It appears as though there are a couple of solutions ahead, but if you look back over time, it's kind of a political football, and in the end, the two parties, or I should say the Congress, and they end up figuring out a way forward. So I'm hopeful that that's going to be the case. I also think that if it's not the case and we have a shutdown, this would be very bad timing, because here we are still in recovery mode. The labor market is still not fully healed. And so this could really throw the wrench in the works if we don't get past this. Now there's a bigger issue about the size of the national debt and whether or not we should do anything about that. It's kind of complicated. A couple of things to think about maybe, and there is some consensus, but not an entire consensus among economists, that maybe during good times we should go into deficit less, maybe even run a surplus and use some of that to pay off the national debt. And at times like we've been going through right now, you're going to incur deficit spending in order to prop up the economy in the absence of the private sector's expansion. And final note, so not that I have answers, I'm just kind of making a couple of points that I think we need to be aware of. Right now, interest rates are at rock bottom lows. So if we are going to borrow as a government, these are the kinds of conditions under which to do so.
Seiji, we've certainly covered it in the newsroom about the upcoming expiration of certain pandemic-era benefits, but you mentioned in your presentation that certain federal unemployment benefit programs are expiring this month, the Pandemic Unemployment Assistance Program and then the Pandemic Additional Compensation Program. Talk a little bit more about those programs and how that expiration is going to affect specifically the Long Beach economy.
Sure. So the Pandemic Unemployment Assistance Program was designed to give assistance to those who would traditionally not qualify for unemployment benefits, right? So we have gig workers, independent contractors, the self-employed. Traditionally, they didn't qualify for unemployment insurance. as part of the CARES Act, unemployment benefits were extended to that group. And so a lot have been applying. Part of those graphs I show of unemployment insurance claims in Long Beach are also extended through the Pandemic Unemployment Assistance Program. But also there's a supplemental benefit, right, to help people through these tough times. The Pandemic Additional Compensation Program provides that, we may have heard in the news, right, that $300 a week supplement to unemployment benefits that has been a lifeline, especially to our lower income unemployed workers. So with the expiration of those, there's a couple of things we might see. One is, of course, those who are in the lowest income category, right? Some of them might be forced to go back to work for relatively low wages. So we might see an uptick in the lower skilled labor employment. But what I'm concerned about is their ability to make ends meet. So for example, I showed you that rent prices are increasing in Long Beach. How are those who are relying a great deal on these supplemental benefits, how are they going to start handling an environment where there's rising prices, right? Dr. Kleinhans showed you that the price levels are rising, there's inflation, housing prices are rising. And so I wish I could predict exactly what's going to happen, but I have concerns, we should say, about the lower end of our income distribution in Long Beach.
Robert?
Yeah, well, so a couple of things I think are worth pointing out. Through any downturn, some sectors of the economy are harder hit than others. So during the Great Recession, we saw that manufacturing and construction were the hardest hit sectors of the economy. In this pandemic downturn, the hardest hit sectors were largely the face-to-face sectors that we've talked about so much. They also happen to be sectors that not only have a large number of low-income workers, they also have a large number of independent or small businesses. Yeah. And so the hit, every economic downturn involves some disruption, and it's often magnified in certain areas. The hit here happens to be in these these sectors that we've talked about, and these income groups that we've talked about. Now we know there are a lot of job openings that are emerging, but somebody who's trying to find a job right now is also going to be concerned about his or her health and that of the members of their household, should they return to a place like a restaurant or something like that. So it just seems to me that this is going to take a while to sort out for these individuals to get back to work, find a place of employment that's going to work for them. And we hear about the shortages of workers in the restaurant sector and so on.
Sure.
There's a lot going on behind the scenes right now.
Robert, I want to stay with you for a second. Speaking of concerns, I know that people share a lot of concerns when they see what's happening with inflation, and you talked a little bit about this during your presentation. But what's your view? Is the current rate of inflation here to stay?
It's elevated right now, and as I said in my remarks, we do tend to see elevated levels of inflation as we recover from any economic downturn, whether it's brought on by economic imbalances or by the pandemic, as is the case here. So we know inflation's likely to be higher than normal at times like this. We all know how supply chains have been disrupted. So that's something that's taking a lot longer than I think we expected would take to iron out, partly because of these surges associated with all these different variants, and the fact that our supply chains are so stretched across the globe. I think early on we started to hear of people rethinking their position on whether or not the supply chain should be stretched so far. But in time, I think those linkages are going to be repaired. Commodities prices are going to come back to earth. We've got high food and energy prices. These are two very volatile components of the overall inflation picture. I think the long-term prospects for example, for oil prices are $65 a barrel, which is kind of where it was before the pandemic hit. So I think gasoline prices are going to come back down to earth. Labor shortages in agriculture are in part contributing to higher prices at the table and in the grocery stores. I think each of these will sort themselves out in time, not overnight, but say by this time next year, I think we're going to be looking at inflation that is closer to what you and I consider to be normal.
We've got about 10 minutes left. I want to turn a little bit to some local and regional issues. The first is the port. The volume of ships floating out there at anchor and kind of steaming around, waiting for a berth. It's one of those things that we've noticed has crossed over into the general public interest, is that people are noticing just the number of ships, the volume that's out there. And Seiji, you mentioned that outbound cargo container volume is fairly flat, but inbound is taking off. And why is that the case, and how does that affect our economy, especially as we're heading into the holiday season?
Sure. So I showed you this graph of consumer spending that during the quarantine just took a dip, and Robert showed you something similar with GDP, where there's this period, between March and say May and June of last year, where consumer spending took a dip. Now, so think about, we buy a lot of stuff, right? And we import a lot of that, and that comes in on containers. In fact, 40% of everything we bring in on containers in this country comes through the Port of Los Angeles and Port of Long Beach. Excuse me, Port of Long Beach and Port of Los Angeles. And so there's this regular volume of ships coming in, dumping off containers. Those containers are being trucked out to warehouses and distribution centers and rail yards. Okay, now all of a sudden there's a pandemic and there's a fast shutdown. Okay, so some of these sailing, people aren't buying anything. These sailings that normally bring in these containers, they're stopped, they're canceled for a while. Okay, what that means is when that large container ship doesn't come and call on Long Beach, that means it's also not there to take all the containers that were dropped off back. So those are going to stay inland until they find a home on a vessel going back. I know there's a long story, but I'm trying to give everybody an understanding of where this is really coming from, why we're seeing what's happening with this imbalance of trade.
Sure.
All right, so now you've got all these containers that are piled up in the wrong places. And now a sudden surge in demand. So you've got skeleton crews from social distancing, so you're having a hard time processing the containers that are coming in. Certainly when they come to the warehouse, you're busy trying to get stuff out of containers. You're not as concerned about getting the empty container over there back to the port, right? You've got skeleton crews that are slowing down the supply chain, and you have containers that are just piled up in all the wrong places. That's creating a container shortage. And now you have a surge in demand. And not only do you have a surge in demand from all the purchasing power we have, possibly some of it, stimulus money motivated, some of it's from lower interest rates, right? There's all this purchasing power that Robert talked about out there, and spending is creating massive demand and pressure on our ports. Okay, so if you're now in a position where you've got a container that you're looking at the inbound market, right? The imports are, it's so hard to find space on a ship and not to mention get space on a truck and space in a warehouse, that prices are being bid up a great deal for the imported containers. So for some carriers, their priority is to get those containers and get them back overseas because they command such a high price. So with all the import demand, you've got the exporters who are competing for space on the ships and competing for containers, where they're sending out relatively low value, not low value and subjectively, I mean just, it's a lot of recycled electronics, a lot of agricultural products, and they don't have the same sort of heft in terms of the dollar value of the container, right? So they're trying to compete for space when import containers prices have tripled and sometimes more than that. So what we're seeing is really they're being exporters are being shut out of the market. And what that means for our broader economy is that our imports are increasing even more relative to our exports, which from a national accounting standpoint means our gross domestic product is falling because we're selling less to the rest of the world and buying more from the rest of the world.
I want to turn to home prices in the few minutes that we've got left. We talked about home prices in Southern California. We talked about home prices around the rest of the state. And I want to talk about legislation in just a minute as well. But home prices in Long Beach and elsewhere are continuing to hit new records at different paces in different parts of the state. Is this a repeat of the price bubble that we saw leading up to the Great Recession? Robert, you want to start? Seiji, sure. Who wants to take it?
I'll take it. So the situation right now, at first glance, looks a lot like what we saw during the lead up to the Great Recession. We saw double-digit increases in home prices in the early 2000s to the mid-2000s. I mean, these were lights out. In some areas, we saw 30 or 40% increases in home prices. We saw some of that in recent months as we were recovering, as the housing market was picking up steam. But unlike the situation back then, the people who are buying homes right now have to have solid credit because of credit standards that are in place today compared to back 15 years ago when, you know, if you could fog a mirror, you'd get a loan. And so a lot of people who really should not have been able to qualify for a loan back then did, and that contributed to the escalation of home prices and eventually to the collapse of home prices as people defaulted on loans when the economy went south. So it's quick and dirty on that one. So it's not like that now. The buyers are in solid shape. We've got a strong demographic factor that's playing into the story right now in the sense, as I mentioned, that the millennial generation, many of them are in prime first-time home buying years of their lives. So there's the demand there. The interest rates are low. Big problem is the supply is just not there in existing homes as well as new homes. We're just not building new homes, and the supply of existing homes is very, very lean. So I don't want to take up.
Yeah, and I mean, I agree with everything you said. And what's different about, you know, the bubble and now is Robert showed us a great graph that shows Treasury yields, which isn't the most exciting thing to look at, but right. But if you, for a non-economist, right? But why that's important for everyone to look at is because those track very closely 30-year mortgages, and in fact, the mortgage industry is going to peg their mortgage rates, their 30-year rates, to those Treasury yields. They're going to track the Treasury yields closely. So mortgage rates are extremely low right now, which is, so there's a clear reason. It's not a mystery like back in 2008 where you have all these no-doc loans driving up prices, you know, that we learned retrospectively. This is, interest rates are low, which means people can afford the monthly payment on a more expensive house.
So with the couple minutes that we have left, you both mentioned supply and shortage. We've had some legislative changes just within the last couple weeks. The governor signed SB 9 and SB 10 that a lot of people say it's the end of single-family zoning in California, that it has the potential to increase the supply of housing. Do you think we'll see any impacts from that? Do you think we're going to suddenly see an influx of new home construction? Is there any insight, anything from the economic perspective to be on the lookout for those legislative changes?
Sure. You want me to go first?
Yes.
Okay. So for one thing, you know, the housing shortfall that we're looking at right now in California and here in Southern California didn't happen overnight. I mean, I've been talking about it for 20 years. And so we need somewhere in the neighborhood of 230 to 250,000 new homes per year to accommodate the growth in households. Setting aside the recent population trends, that we have a severe housing shortage. This bill, based on some research done by Turner Center at UC Berkeley, might bring forth about 700,000 housing units. So it is a step in the right direction. I know we talked earlier, and I mentioned 70, I misquoted. Okay. So it is a step in the right direction, but the problem, in my opinion, that we need to consider with this type of move is to what extent should land use control remain local as opposed to being a part of the domain, if you will, of the state legislature. So we'll see how this plays out. It can't hurt, but we need a whole lot more housing than would be unleashed, if you will, by this measure.
Sure. Yeah, I think it's really going to come down to what are our preferences overall with regard to housing as an economy. I mean, on one hand, you have bedroom communities surrounding Long Beach, like Lakewood, where they take a lot of pride in having single-family homes. That's their brand, and they essentially provide labor to the surrounding economy. All right, so there might be concerns that, well, now all of a sudden there's no local control over maintaining that bedroom community feel. But at the same time, if you want to grow the local economy and you want to grow wages in that local economy, you need to bring people in, right? And they need a place to live. So I don't know if SB 9 is the answer economically, but it's certainly addressing an important question that Robert's been talking about for 20 years, is if you want to grow the region, you need to bring in talent. And if you want to bring in talent, they have to be able to live somewhere.
I would just point out, you know, we actually should think about it in terms of whether or not a one-size-fits-all policy will work in a state that's as large, having 40 million people, and as diverse as it is with the various regions of the state. And I'm not just talking about housing policy, but other types of policies. It's a tough act to pull off.
I wish we had another half hour. I could keep going from there, but we're going to have to wrap it up. Dr. Seiji Steinmetz, Dr. Robert Kleinhans, you'll be back with us next quarter. We're going to leave it there for all of us here at the Long Beach Economic Partnership. You can follow the partnership on our social media accounts or online at lbep.org. longbeachlongbeach.org. From all of us at Accelerate Long Beach, thank you for joining us today. Thank you to you both, and we will see you next time.